Vietnam is a densely populated developing country with over 90 million people. It is among one of the poorest nations in the world, with an average income of $1,000 or less per person, and over 50% of its labor force in agriculture. In the last 40 years, Vietnam has suffered the consequences of poverty, genocide, years of war, lack of natural resources, poor farm management, and limited access to clean water and healthcare. During the Vietnam War, the United States sprayed up to 18 million gallons of Agent Orange around Vietnam. And 4 decades on, Agent Orange continues to ravage the children of those exposed. The Vietnamese government estimates that as many as 400,000 Vietnamese have died from illnesses related to exposure to dioxin, such as cancer. They also claim that up to 500,000 children have birth defects. Humanitarian Services for Children of Vietnam provides relief to children living in poverty in northern Vietnam through a variety of specialized programs designed to establish a solid foundation for each child. Children receive direct assistance by way of food, clothing, shelter, schooling, and medical assistance. These programs serve as sources of basic support for children as well as their communities. Examples of our programs include construction of homes for families living in impoverished conditions, monthly donations of rice to families, educational scholarships for students, corrective orthopedic surgeries, and open heart surgeries for children with heart disease. HSCV offers donors the opportunity to build relationships with children and their families through direct sponsorship. When you become a direct sponsor, you will receive a photo and information about the child and or family you are sponsoring. In addition, you will receive personal letters from them. We encourage sponsors to write return letters in order to build close relationships with their sponsored children and or families.